Hi all, so today we're going to be having a look at the Arden's headache template. Now you can access this from the bottom left hand search bar, just type in headache. And as you can see, you've got it on your pick list. So when I select that, it takes us into the Arden's headache template. Now you can see that we've got the following pages along the top. You see about your consultation, your causes, your referral and your patient resources. So starting with our consultation, we can run through with the assessment. Now we can state if it is or is not a review, and then we can build up the patient's consultation details. Now you can free text in here, however you can also use these presets. You can select multiple presets just by holding Control down and selecting like so, and do exactly the same for examination. Now moving down, we have our red flags, and here we can state if the patient has severe unilateral red eye pain or hazy cornea. We can keep working through our red flags. We will state that patient has fever and a stiff neck. You'll also notice we have quick links here into the meningitis template, the brain cancer template and your formulary templates. We do also have action or options to go into your vitals and lifestyles. This houses things like your SATs, so your height, your weight, your BP. Now underneath impressions, you've got your suspected option. Now this is where you can put some text in here or use the preset. However, if you are sure about the diagnosis, you can use the diagnosis box below, and that will put a read code against the patient's record. Now the management plan can be used exactly the same way as our history and examination fields. By selecting our preset, we can always just type in here though. Moving down, we do have access and options to say advice if worsens, no better or any other concerns. And we also have a headache diary. Now these are really handy because we can print out to the patient by selecting this option here. It'll print with the patient's diary, their instructions, and you'll also have the name along the top. We do also have options to jump into your other formularies, and all of our drugs formulary templates work exactly the same. Now the next page that we're going to go to is our causes page. Now our red flags here do work part and parcel with our red flags here. So from our consultation page, you can see that we've said severe unilateral red eye pain and hazy cornea. We can now match that up to say there's a possibility or a probability of glaucoma. And we're also going to say there's a probability of meningitis. We can keep working through and saying what other common causes are. So things like eye strain, medication induced or migraine. And you also have your other causes. Now the next option is our referral page, and this is where we consider an emergency referral or urgent referral. And you have your different criteria options here. We do also have access to the urgent MRI referral, which is within 2 weeks, and that's for progressive subacute loss of central neurological function. Or you have your urgent referral, which is within 48 hours. Now the last page on here are our resources, and this is where we can give patients self-help information. We do also have access to your clinical knowledge summaries and your NICE guidelines. So we can open up these links, which will take us into the patient.info website, where you can then print off that self-help leaflet and give it to the patient. However, we do also have the access to send these leaflets via text or email. So just below it does give you a little MB to say what to do and how to do it. So if we were going to send via email or SMS, it says highlight above. So left click and drag, and it says copy with a Control and C. And it says open up either or, and then just paste the link in with a Control and V. Now if I was to hit OK at that point, That would send from the practice email to the patient's mobile. That's saving time, money, paper, toners. So a really good integrated way of sending them. Once everything has been complete in the template, as ever, press OK at the bottom and save the patient's notes.